Thank you very much. It's great to have an opportunity to present to this group. The 20 years has been spectacular, and looking forward to Wavefront Congress continuing to add to all of our knowledge. I'm going to give you kind of what might be a new term, but femtolenticular corneal shaping. And at the end of this talk, you'll see why we're coming up with kind of a broad-based term to cover all of these procedures. These are my potential conflicts of interest for this particular talk. I have to admit, when SMILE was first introduced 15 years ago, I was a real skeptic. We'd actually tried some of this in 2000, 2001 with interlays, and I really felt that the cornea was not going to respond well to this interlenticular approach. But it's just great to be wrong. And I think now I'm clear over on the other side. So I'm also now starting to think, is LASIK really going to join some of the other procedures that we've left behind as we're starting to develop this new technology? And this is so it's great for the people that are supporters of the Wavefront Congress, because we need to start thinking about the optics, the biomechanics, all the things that we need to do to see if that's going to happen. And I want to jump ahead a little bit because I'm going to go to 2030. And the reason I picked that is that's 8.5 years away. And the way technology, the timing of technology developments, anything that we're going to develop now is going to be kind of in its mainstay about 7 or 8 years from now. So I'm going to give you my prediction about the future of refractive surgery broadly defined. In corneal-based refractive surgery, I think that ray tracing, OCT, topography, wavefront, and all the things that we've been working on will still have a significant play in this, and even more of a role from a diagnostic side. PRK, surface ablation, will survive, in my opinion. It's always been between 12 and 20% of our treatments, and I think it will continue, maybe in a little bit smaller role. I think transepithelial treatments will be the mainstay with some of the work that companies like Schmidt have done with SmartSurf. But the big thing is I think that lenticular corneal shaping will replace LASIK over this period of time as the dominant procedure. LASIK has been fantastic, but there's something really nice about no epithelial defect and no flap from not only the patient standpoint, from our standpoint, but probably the biggest reason I think there is that you have to follow the corporate investment. And I think you'll see this in this talk about where the corporations are going. For this talk and a keynote that I'm giving at the Academy, I've been interviewing all the companies on how much are you investing in excimer LASIK technology and how much are you investing in lenticular technology. And it's pretty striking about where the companies are going. Also, another pressure on LASIK is going to be lens-based refractive surgery. You're going to see this LBRS term a lot. And phakic IOLs are having a big impact worldwide, and I think will continue to flourish. And the other one is really refractive lens exchange. One thing I've learned over my career, and I've been involved in every procedure for presbyopia there has been, but it's really kind of hit me in the face that this is a lens disease. And with everything that's happening with our lenses that are getting better, I think we're going to move to the point where this will be a driving factor in the presbyopia with the lenses we have now and lenses in the future. And I think we'll be switching, and this is a big switch. We always wait for a cataract to mature, both for doctors and patients. I think we'll be going out and preventing cataracts, which is really what we should be doing with lens replacement surgery for presbyopia. I really want to congratulate Zeiss on just a tremendous job they've done in introducing SMILE with over 4 million procedures done. They've really taken this procedure and really taken it to a great place. Not only is it a large number of installations, this map kind of shows you it's every place. Every place that we're doing refractive surgery, SMILE is there. But the big thing here is the 500 peer-reviewed publications. I really admire the doctors that have worked on this, Zeiss that supported it. And I think this is what we need to continue to do as other companies get in this, is require scientific evidence. The growth of SMILE has been exponential. I think we all know that. And if we really look at some of the statistics using US market scope data, even though SMILE started out small, if we kind of look at the fourth quarter of 2020, The overall refractive surgery growth was 4.9%, but SMILE grew 36%. And it's now up to at that point in time was 7.2% of the procedures in the US. And recently, this was a couple of weeks ago, the Refractive Surgery Council, which has the real data from the companies, showed that there was a 30% rise in the overall corneal refractive procedures in the first quarter of this year, which is really tremendous. And it's going to be great to see how much of that was lenticular procedures versus SMILE and LASIK as the data is looked at a little bit more carefully. Also, SMILE is accepted in the military. This is my picture is my good friend, Bruce Rivers, who's director of the Warfighters program and has done a lot of work in the military, because you can see how good this, again, no epithelial defect, no flap, is nice for soldiers too. So again, I want to congratulate Zeiss, the only FDA-approved lenticular procedure at this point in time. And they have studies going on and they're continuing doing a great job. But there's a whole bunch of femto companies out there. And these are all capable of kind of getting into this field as it develops. And there's others that we don't even know about yet that can get into this field. So I'm going to give you a little heads up on some of the ones that are coming. Schwint has the ATOS laser system that is CE marked. It's not available in the United States, and their procedure is called SmartSight. So this is one of the lenticular procedures that's coming along. And it's really almost refreshing to me, since I've been in this field for a long time, to watch the promotional things, because now it looks like the early excimer days where everybody's going to say mine's better than yours, or I'm going to outperform you, and love the competition. It's what we need again in this particular area. But as you can see, these are getting smaller, they're getting more portable, and the advanced procedures that are coming along have cycle torsion compensation, also automatic centration. I've used this laser on iBank eyes, and it's very impressive on how that technology works. And I think it's going to be exciting as data starts being developed. Also, and again, I love to see these things is here's all the things we can do for you, buy my laser, which all the companies are going to get into. Just like the early femto days and the early excimer days. Everybody's going to be working around each other's patents. So this will be kind of innovative technology that we're going to need a lot of input from all of us on how to do that. And also the design teams are great. Anytime Teo is interested in something, I'm interested in what's going on. So it's fun to be watching him develop again. And also Kishore from Nepal just published the first set of data. It just came out in JCRS last week. And you can't read this, but I've read the article, and it's from 3 to 11.5 diopters of myopia. These are the first cases, the first 104 eyes. And I've looked at the data. The data is very good for an out-of-the-box early procedure. And probably the most important thing is all the procedures were completed successfully. All the lenticles were extracted successfully. And Kishore is a very experienced SMILE surgeon, but this is good to make sure that the laser is doing its part. And we'll be seeing more of this as it comes out. And Ross Schwint and the team are making this a platform technology, so that they're planning on a machine that can do a lot of things now and in the future. J&J's FLCS laser system is called Alita. First time I'd heard that name when I went back to him was just recently. It was called Cheetah in its developing areas. For those of you who had seen it before, I've used this laser in prototype stage several times, and it's really impressive. I think it's something that's not available in the US yet, but J&J is doing a lot of other things. This is from their ARVO poster on the accuracy of this laser and lenticular development. And I love seeing this from getting out in the scientific community, looking at the accuracy and the range of myopia that we need to be seeing. Also, hyperopia patterns starting to come out. And I really encourage these companies to present things at ARVO, present things at Wavefront Congress and other congresses to get our information out. This is another poster, and it gives you a little bit of an idea what the laser looks like. Smaller, it does have autocentration. It has a very unique ablation pattern, which is new and different, which I think is something that's going to be the type of things companies are going to come up with. Zemer has introduced Clear. It is CE marked. They are not available in the US. They're planning a US clinical trial. Patients have been done in the early stages of that. And they're starting to promote it under this name of Clear. It's kind of interesting. If you look at the Clear name, corneal lenticular extraction for advanced refractive correction. And any of us have been in these kind of think tank things and coming up with a name. That took a little while to get it into Clear, but I love the name. And the unique thing about this one, as opposed to the other companies that have new machines, this is just going right into the Z8. So it's a software upgrade into the people who have already bought a C8. And so they're kind of sticking with their idea of giving, as you move up the scale of their Z lasers, there's more procedures that can be done. And now they'll just have to make this a little taller to put the femtolenticular procedures into the Z8, but that's a nice strategy. So they do have CE mark, and they were CE mark for approved for Clear. So that's the marking name that's out there with the CE mark. And they also were cleared for the Z8 for children's cataract surgery in Europe, which is another area that's really important. My daughter's a pediatric ophthalmologist. So these are the tough cataracts, and it'd be nice to have technologies in that area. And again, in the promotional thing, this is going to have ability to center. You're going to be able to choose your centration method, and there is cycle torsion, and the laser is fairly mobile. So again, promotional things. Everybody's going to be saying that buy mine, and here's why it should be interest to you. But it's all going to come from the data, just like it should be. One I'll throw in that you may not have heard of, Caranova. I've been interested in this laser for quite a while. It's a French company. They have a very interesting technology that actually has 8 femtosecond beams running all at the same time. So it's super fast. And they mainly have been focusing on lens-based procedures to actually do away with phacoemulsification, which I think is maybe a next step there. But it's kind of an automated process, almost robotic. You push the button, it finds the eye, lines up, auto docks, and then does the treatment. But if you look into their areas of potential development, you can see soon our equipment will also be equipped, without change to the core system, with intrastromal refractive surgery. There we have our terminology coming about, even in some of our companies that have been focusing on lens procedures. And we cannot forget about Zeiss. Zeiss is the leader. They are the big leader, and they have new systems coming along, and they'll be smart and hold them back until the other competition starts moving ahead. And then they'll really be working on trying to move that program along. As you know, their laser right now is big. It's not portable, and it doesn't auto center or cycle rotate, but I'm sure that the next technologies will meet the competition there.